2 weeks ago, NHS Scotland updated their infection prevention and control guidance, with the same guidelines being adopted in Wales. There's a lot to unpack here, but I'll do my best to summarise. Where modes of transmission were previously defined as contact, droplet and airborne, this would determine the relevant mask to be used. Under the new guidance, both droplet and airborne have been replaced by air transmission. Any infectious diseases spread via the air are now categorised into three groups: R1, R2 and R3, with R3 deemed to be the highest risk. If a patient has an infection classed as R2 or R3, an FFP3 mask is recommended. If the patient has an R1 infection, a surgical mask would suffice. You'll notice that COVID-19 is classed as R1, the lowest risk, suggesting that a surgical mask should be worn. These categories have been informed by the UK HSA and their definition of high consequence infectious diseases, or HSIDs. Should COVID-19 be classed as a HSID? Arguably, mortality is low, but I'm not sure that provides any comfort to those who've lost loved ones to COVID-19. Similarly, there's no regard for the millions being disabled by long COVID. Suggesting there are effective prophylactics or treatments for COVID-19 is also debatable, particularly with the news that access to vaccines will be restricted further next year. What's quite bewildering is that the literature review considered a large body of evidence advocating for the use of FFP3 masks instead of surgical masks. Yet the review highlights a lack of studies that found non-significant differences and that this might bias the review. Now, call me naive, but maybe the reason why there are no such studies is there's very little evidence suggests this is actually the case. Among the anticipated harms identified were discomfort during wearing and the costs associated with providing FFP3 masks and fit testing staff. I would have thought protecting healthcare workers would be a priority and would justify at least some financial costs. What's also striking is the advice that rooms should be left vacant for 10 minutes after the patient has been discharged. This is to allow larger respiratory particles to settle. Bear in mind, SARS-CoV-2 can linger in the air for several hours. There's no reference to any ventilation measures in this scenario either. In fact, there's little regard to ventilation measures full stop, or air filtration for that matter. On a more positive note, NHS staff have the option of wearing an FFP3 mask if they want to. My advice to them is to seriously consider it. You can view the manual for yourself on the NHS Scotland website. If you have any thoughts on this, please do comment below.